this is the second case. This is a 25-year-old female admitted to the ICU from the floors in view of severe abdominal pain, vomiting and dyspnea. She had fever, body ache and headache for 6 days and was admitted to hospital 3 days prior. On examination, her pulse is 106, her blood pressure is 86/76. She is dyspneic, air entry reduced bilaterally, and her saturation is 92% on 4 liters of oxygen through a nasal cannula. The investigation done on the floor revealed hemoglobin of 16, a WBC count of 2,300, platelets at 28,000, BUN and creatinine were normal, sodium was normal, LFT was mildly abnormal, the smear for malaria was negative, rapid malaria test was negative, NS1 antigen was negative, IgM anti-dengue was negative, and IgG anti-dengue was positive. X-ray test revealed bilateral infiltrates and bilateral effusions. So, what is the diagnosis and why? This is a patient, of course, like I said, the salient features of the clinical exam history. One is that her blood pressure is 86/76. She is hypotensive with a very narrow pulse pressure. Her hemoglobin is 16. She therefore has a high hematocrit. She has a neutropenia. Platelets are very severe thrombocytopenia. NS1 negative, but IgG anti-dengue is positive and malaria is negative. X-rays suggest a bilateral infiltrates, most probably due to a capillary leak. So, this patient has severe dengue because of all these reasons: the high hematocrit, the narrow pulse pressure, the thrombocytopenia, the neutropenia, and the positive IgG anti-dengue. Of course, you might ask, generally we say IgM anti-dengue should be positive. Here only the IgG anti-dengue is positive. So, why is it so in this case? Why is the IgM anti-dengue, which we generally say in acute infections, IgM anti-dengue should become positive, but why is the IgM anti-dengue negative but IgG anti-dengue positive in this case? So, now you must remember that there are 4 serotypes of dengue which can cause infection. Therefore, theoretically, an individual can get dengue 4 times in his lifetime because there are 4 different serotypes. Infection by one serotype confers immunity only against lifelong immunity only against that particular serotype. But during a season, there is transient protection against the other serotypes. Therefore, in a season, a patient can get dengue only once, but in a lifetime, a person can get dengue at least 4 times, because those antibodies which are initially protective, after a couple of months become no longer protective antibodies against other serotypes. Therefore, when a patient gets the first attack of dengue, usually there are serotypes that are formed which give protection against other serotypes for 6 months and lifelong protection against that serotype. And generally, primary dengue, which is also the first attack of dengue, generally is not so severe. But the second time the patient gets an infection from another type of serotype, these antibodies from the previous infection are no longer neutralizing, they are non-neutralizing antibodies. So, they no longer protect the patient from the second serotype of virus. But these antibodies, they attach themselves to the dengue virus. Though they don't neutralize the virus, they allow the virus to gain much better entry into the macrophages, where the dengue virus multiplies much faster, much better. Therefore, these antibodies are now called enhancing antibodies. They actually amplify the multiplication of the dengue virus and also amplify the immune response, which is why the secondary attack of dengue is generally much more severe than the primary attack of dengue, because of antibody dependent enhancement. Which is why we can explain the lab feature secondary dengue. In primary infection, what happens is that the viremia NS1 comes up first for the first 1 to 7 days. IgM antibody comes up after a few days and IgG comes up much later. But in secondary dengue, the antigen antibody complexes mop up the virus and the virus much faster, because the antigen antibody complexes develop. Therefore, viremia lasts only 4 or 5 days. NH1 becomes negative within 4 or 5 days. IgG antibodies, because of memory, IgG antibodies come up faster much earlier, and IgM comes up little later. Therefore, in primary dengue, whereas IgM comes up earlier faster, in secondary dengue it's possible that the IgG might be positive first and then the IgM. Therefore, in a suspected patient of dengue, it is better to do all 3, NS1, IgG and IgM, because depending upon which phase of the disease the patient is in, any one of them can come positive. And if you try to save money and don't do all 3 tests, you might sometimes miss the diagnosis of dengue.